Hi, my name is Adrienne Wilson, and this project is for my Nursing 306 class here at ODU. We have spent a lot of time talking about theoretical frameworks by all these wonderful people, but today I'm going to talk to you about a professional practice model in which many healthcare systems use, and me specifically, I'm going to talk about VCU Health System. VCU is a very big place. Many people think it's just one place. In actuality, it's many different hospitals and clinics that make up the health system. You have the VCU Medical Center, you have the Children's Hospital of Virginia, both of which are located in downtown Richmond, and you also have Community Memorial Hospital, which is located in South Hill. Also, you have over 70 satellite clinics in Virginia, some of which include physical therapy, occupational therapy, general primary care, cardiology, endocrinology, neurology, outpatient surgery, and many more. The one I'm specifically going to talk about is VCU Medical Center here in downtown Richmond. They're considered a level 1 trauma center, a level 1 pediatric trauma center, and a level 1 burn center. Within this hospital, they have different hospitals, which sounds kind of weird, but they do. They have the North Hospital, the West Hospital, the Critical Care Hospital, and the Main Hospital. Altogether, they have 870 inpatient beds and 75 emergency room beds. They have many different specialties, and all in which include trauma, cardiology, acute care surgery, medicine beds, neurology, orthopedic surgery, psych, rehab, labor and delivery, women's health, pediatrics, oncology, burn, and plastics. They also have their ICUs, which are the medical respiratory ICU, the surgery trauma ICU, the cardiac surgery ICU, the coronary ICU, the burn ICU, and the pediatric ICU, as well as the neonatal ICU. So there's many different specialties that they have. This professional practice model that was created within the healthcare system. The structure of this professional practice model is set to reflect the strength and components it takes to be a strong healthcare system. On the pillars are the words caring, knowledge, leadership, and collaboration. First off, caring is a basic knowledge nursing skill that nurses have to have in order to function. Nurses need to have the medical knowledge, but also be culturally aware and understanding of a patient as a whole, whether it be mentally, physically, or spiritually. Leadership is also very important because it's a big part of patient advocacy, health promotion, and maintenance. Nurses need to have the ability to collaborate with other healthcare professionals because we aren't the only people who take care of patients. It's rather a team effort. This includes physicians, physical therapy, occupational therapy, social work, dietitians, nutritional support, psych, and care coordination. On the stair, you can see the words patient, family, and community. Walking up to those doors, meaning not only to serve the patient, but also family members and community as well. These components create a relationship-based care delivery system. With my experience I have in nursing school, work, and clinicals, I think VCU's professional practice model is a great framework and reflection of nursing practice, as well as other healthcare team practices. Even though many institutions have different professional practice models, I think nursing is a universal practice. So this model could perfectly fit in other institutions. Inclusion of the client, the family, and other healthcare professionals in care is very important no matter where you work. I think this model provides a basic structure of holistic care because it provides a foundation of care of the patient as a whole and not just a simple diagnosis. Nursing are in a profession where they have to make decisions, implement interventions based off their intuition, and I think that's what makes them so great. Having this leadership knowledge and being able to communicate with other healthcare professional teams helps escalate and prioritize care for our clients. When the patient leaves the hospital, they are sent a patient satisfaction survey, either by mail or email, and they are able to speak about the care that was given to them during their stay or visit at the health system. Some of the questions that were up there were, how does the patient rate the hospital overall? And it was 78% rated it as a 9 or a 10, 10 being the most. Would patients recommend this hospital to a friend or family? 80% rated yes, and how often does the nurse communicate with the patient? And 83% rated always. Ever since they have incorporated this professional practice model within the healthcare institution, these rates have increased steadily. As seen on the website, these numbers are predicted to increase to 90% within the next 2 years. VCU Medical Center is a great place to get medical care as well as grow and advance as a healthcare professional. The use of a professional practice model creates a foundation of nursing built from theoretical frameworks to help provide the best quality care there is. You can check out some of the links I have provided if you want to learn a little more about this wonderful healthcare system. Thank you.